Now lymph node, we'll be discussing lymph node. There are two beautiful slides. Please take care when you are viewing. Last day one slide was broken. It was an accident anyway, but you can prevent accidents. The day you came to the college, I think first I met you, I told you, please handle with care. So, this is one thing I'm just discussing now. Lymph node. Now, lymph node, now these are two illustrations, and most lymph nodes in childhood are swollen up. You can palpate them, you can see them due to many reasons. A mother comes with a child of 1 year, 6 months, or 2 years, 7 years, 11 years, with the inguinal lymph node swelling, with a lymph node of the head and neck region, in the submental region, in the parotid region, in the scalp. These are common findings, and the parents or mother who brings the child will point to you that Dr. Saab, देखो क्या है इधर. You please see. Now you, এটা কি guilty দাঁড়িয়ে গেছে. Now you have to mukabala. You have to assure that she need not panic, but you cannot ignore, because in clinical practice, and you just, oh না না ওটা কিছু হবে না, ওপর ঠিক আছে, or you just keep bum prescription লিখতে লাগলে. The AI chat GPT ওকে ফরওয়ার্ড করে বলে দিলে তুমি করে দাও, ওষুধটা লিখে নাও. Human touch should be there. You have to palpate, you have to feel, you have to feel the consistency, you have to feel because if you overlook, when the patient is pointing to you, তুমি তো মেশিন নিয়ে বসে থাকছো না চেম্বারে, তুমি ওয়ার্ল্ডের কোথাও মেশিন নিয়ে বসে থাকে না. তোমরা তো পড়ে নেবে, you will read it in your books. Kintu what I'm telling you, that it might be this neck gland swelling most commonly in the children. Actually, what happens if there is an abscess, if there is some cough and cold, bad this thing, so the lymph nodes swells up, and you see any lymph node in the submandibular region, then you see the tonsils first. ENT को भेजेगा ना, ऑन्कोलॉजी को भेजेगा, ऑन्कोलॉजिस्ट को भेजेगा, तो ये आपका सोच नहीं होगा. You see it, your good MBBS is a good PG. So you just then refer. Before referring, you can do one thing, that is, you see what vaccinations that child has undergone, what any episodes of fever, pyrexia, or some illness, or any impetigo, boils in the head and scalp, any infective cyst. Now, these are the things that drain into the area concerned with the pathological condition of that patient, is manifested in your lymph node swelling. You have finished abdomen, you have finished the inguinal region, the inguinal canal, and you have finished pelvic organs. Now, many things that the drainage system. See, now whenever you are seeing, you please see and feel how it is, what is it is. So you just have to investigate that what is the reason why the lymph node has been swollen. You are minute seconds, you ask yourself the questions, that it can be what, it can be what can be what. And accordingly, the simple things you have to do is that you do a complete hemogram to see, and the CBC with hemoglobin, and if he has some pathological condition, some boil or tumor or something like that, you have to take into notice. You do an USG. That is the simplest and most informative your imaging instrument. Even in USGs are being used in interventional cardiology, putting stents and all this. They are putting probes and seeing the condition of the vessel. Now, that is I just saying regarding USG's importance. And you do a fine needle aspiration cytology, FNAC, and see what is the cellular structure, what is the report. It can be in non-specific lymphadenitis or lymphadenopathy, or it can be COX, which is very common in our country, or just an inflammatory this thing. It's not always malignant, and for these reasons, malignancy is very rare, but it is not uncommon, it is common also. See, just one thing I tell you. Now, these are the conditions where you have to palpate, you have to feel, you have to decide, take a biopsy or an FNAC. If you are not satisfied with the hematological report and your fine needle aspiration cytology, FNAC, fine needle aspiration cytology. FNAC, Fine Needle Aspiration Cytology. Now, these things, this aspiration cytology, when you are in the clinics, when you are doing your rounds in the ward, seeing patients, then you can take a syringe and you take you put it into the lymph node and take it out. And you spread it on the slide, fix it, send it to the lab. You withdraw blood when you are doing an internship. You withdraw blood. No one will devour you. No one will prevent you from doing things. Now, you won't call, today I spoke to you just a glimpse, I will say, মানে একটা যে ঝাপসা আপসা দেখার ব্যাপার ছিল, যে একটা মনের মধ্যে 130টা স্লাইডের মধ্যে হয়তো দেখা যাবে তোমরা 60টা 70টা মনে রেখেছো, আমি তাড়াতাড়ি দেখিয়ে দিয়েছি যে এইগুলো একটা টোটাল সিস্টেম। Now, what I want to say is that don't ignore the swellings of the lymph nodes. See, if you find a lymph node over here in the left supraclavicular region, and the patient is complaining of gastric hemorrhage, pain in the stomach, vomiting, there might be obstruction in the duodenum, and even if there is no hematemesis, then it can happen that you can get black tardy stool. I'm saying for the elder people, especially males, that this is known as Virchow's gland. That gives you a signal that there is some wrong with some cancerous. It might be that it's some cancer of the stomach, malignancy of the stomach. So you just take an FNAC and then do. Of course, you have to do. You will say, "Nahi sir, humko kya idhar needle?" It's not very informative, but there it can give you information. And by the time the blood report and this thing goes on, your FNAC report comes. Then that patient will go an endoscopy date, and you go for an endoscope. You will view that it is, or your gastroenterologist to your friend will give you the images of the endoscope. And then if these two things are related, then you have to you send it to the oncologist and oncosurgeon. Accordingly, they will decide that they will go for a gastrointestinal surgery, bypass surgery, gastrectomy with jejunum, and all this intestines are, there are different types, the names are there for the different types of operations. Now, this is one thing. Another thing is that now this is a female. Now, if there is any malignancy in the organ, now the lymph drains into the few in the inguinal lymph nodes. So if there's, but not always. Then you ask her, then the gynecological examinations you do. It might be that Now this is more or less a normal cervix, and this is a bulky cervix with ectropion. The cervix is spread like this, opened up. If you see, do a pervaginal examination, you will see it's bulky, and then you put a speculum, you will see the the red ectropion, that cervix, it goes curled up with this thing. So it might be a pre-malignant condition, or then you have to go for, and that, if it is, that drains these are the, it is in the spew in this thing, and the iliac group lymph nodes. Now, why I'm telling you that, see, you have to, don't tell a choto, ye guilty dadiyeche don't. It gives you a clue, the small thing, this thing. I want you to tell you that histology সঙ্গে কি আছে এটা? Histology সঙ্গে আছে, histopathology সঙ্গে আছে. And MBBS, when you are in MBBS, you have to, general physician and there is no place for general physician. But you don't have, we are having 800 beds ready, prepared. But are we getting so many patients? And still it will be unless your batch pass out, then we expect, without any biasness, that the hospital will run in its own format. But I have to climb Mount Everest. I must know what is the map. A trek alone, or should I take some Sherpa? It is like that. So these accessories are Sherpas. So you have to know it. You have to know the normal anatomy. And you will be seeing it in histopathology. You will be seeing a tuberculosis lymph node. It will be taught to you in your medicine and also in histopathology. So that slide, how it looks. If you don't know the normal, then everything will be disrupted. A normal liver and a cirrhotic liver. What is the tissue consistency of the normal liver and consistency of the your cirrhotic liver? Now, lymph node is a small kidney-shaped structure that filters lymph. Node has a convex surface and concave area hilum. Each lymph node receives lymph through many afferent lymphatic vessels. Each lymph node has efferent lymphatic vessels through which filtered lymph leave through the hilum. Lymph node receives blood vessels through the hilum. Now, when you have to dissect one lymph node, then you have to at least know the position of, there will be only one blood vessel. So you dissect, bleed korte laglo. Ekhane clamp korle. No. You just see where is the bleeding point, clamp, and then you dissect out. And the other side, the places where the lymph vessels are coming out, then you ligate and suture. Then you fix that and send it for histopathology. Now, histology of lymph node. Section of lymph node shows capsule, subcapsular sinus, outer cortex, paracortex, and medulla. This will be questioned in Viva. Okay. Now, it can be a MCQ also. You need not that it will be, they won't ask you anything in Viva. They will be on spotting whatever you are identified the slide, that will be you have to put in, and also 1 or 2 notes in support of your, if you get the time, and you must, you will get the time. So you just write that you just section of the lymph node shows capsule, and subcapsular sinus, outer cortex, paracortex, medulla, this can be this thing. Now every one of you is taking photograph of the slides. Mobile, you are taking photograph. I am not saying micro photograph, because taking a picture through the mobile is not micro photography, because micro photography is totally specialized aspect of photography. Now I want to say, you have to see, this is the apparent. Now capsule is covered by connective tissue capsule. It is made up of dense connective tissue. Lymph node is covered by connective tissue. It is made up of dense. Lymph node is covered by connective tissue capsule. It is made up of dense connective tissue. Trabeculae extends from capsule in the substance of lymph node. This picture, I've gone back to the previous slide. Now you see the trabeculae. You can see the trabeculae. You can see the deep cortex. This is superficial cortex, and this is the medulla. The medullary sinuses. This is sinuses. Trabecular sinuses. Subscapular sinus. This is subscapular sinus, and this is the vein and artery. So, efferent lymphatic vessels. This goes out, and this goes in. Now, one thing I tell you, that when you encounter this thing, you just you dissect out. You will see the blood vessel is there, supplying into the hilum. So you clamp and then excise. So there will be least bleeding and least damage to the in the wound bed, because the more trauma is there, there will be more fibrosis, more in the wound healing problem. But if you have a clean cut and this thing, the idea that these vessels are running in this place, you clamp and then ligate and cut. This is one thing. Second thing, now see, the capsule is here, subscapular cortex, trabeculae, trabecular sinus, lymphatic nodule. This is lymphatic nodule. This round circle, lymphatic nodule, and germinal cortex. Now medullary sinusoids. This is the medulla, deep cortex, superficial cortex. This is the medulla. Now you please come, see, and move off. আমি না বললেও move off, আমি বললেও move off. ঠিক আছে? So you see, and by next week, you please complete your khata.